My name is Jim Blando, and I'm a faculty member in the School of Community and Environmental Health at Old Dominion University in Norfolk, Virginia. I just want to talk to you today a little bit about one of the career options within our college, which is in the College of Health Sciences, and talk to some students who have gone through our undergraduate program. We have an undergraduate program, a BS, Bachelor of Science degree in Environmental Health. And environmental health is a pretty diverse discipline, as I think you're going to see and hear about from our students who are participating today. Environmental health is a very broad field. Generally speaking, some of us think of environmental health as being within the broader umbrella of public health. However, some of our students take a little bit more of an engineering focus, and some of our students take a little bit more of a sort of public health focus. But our degree essentially utilizes all of the basic sciences to do things like work as an industrial hygienist. Most people don't really know what industrial hygiene is until they get familiar with the field. But that's essentially a profession where we work in industrial settings to check workers and keep the workplace safe and clean and free of hazards. Also, some of our students will work as environmental health professionals, which are folks who do everything from going out to inspect restaurants for sanitation to controlling pollutants that are released to the environment. An example of that would be students who are working for the Environmental Protection Agency as an environmental specialist, for example, or an environmental engineer. And some of our students work in straight safety sciences, which are folks who are going out to construction sites and trying to make sure that people aren't falling off scaffolding or injuring themselves through various types of accidents that can occur in those types of settings. Our job prospects are very good. I think probably about 95% of our students have had jobs within 6 months of graduation. Our starting salaries range anywhere from 45 to 65 for undergraduate students who are just starting out in the profession. As you tend to work in the profession, you tend to earn more money. The average salary for many folks in our profession are in the $80,000 to $100,000 a year range. One of the other exciting things about our profession that I think makes it very worthwhile is we generally can go home at the end of the day and feel pretty good about the fact that we are trying to protect people and make things better. Not only protect people, but also protect the environment. Some of our students work solely in water quality, in ecosystem protection, and so on as well. So it's a very diverse, very broad field. Because we are located in Norfolk, Virginia, many of our students find jobs with the Navy and the shipyard, which are heavy industrial settings. And therefore, most of our students, quite frankly, get jobs in industrial hygiene and safety. For our students who leave the area and go to other areas of the country, they may find a diverse array of other professions and job titles that they would typically find themselves employed in. So with that said, I want to introduce two of our students who have recently gone through our undergraduate program, and you can see them here on the slide, Suzy Weigle and Erika Thornton. Thank you guys for joining us. And I'm just going to ask you guys a couple questions, and I guess we'll start with Erika. And the first question is, just tell us about yourself and why you chose to pursue a career in environmental health, occupational safety, and industrial hygiene.
Well, I originally wanted to do something with social sciences, like psychology or something along those lines, because I've always had an interest in people, altruism, helping, and things like that. But it didn't feel right to me. Because it didn't encompass as much of the other aspects of things that I'm really passionate about and really love, and that was like the sciences and the math and things like that. So when I discovered environmental health and safety that had all of those things rolled up in one, I was ecstatic. And not only is it about the health and safety of people, but it's masses. So instead of focusing on the health and safety of a single person, like a doctor or a nurse or something like that would, as they roll through, it's a couple of hundred people or maybe 1,000 people at your workplace at one time, ensuring that they are kept safe and healthy, and that to me is really what sold it.
Well, thank you, Erika. Appreciate it. Suzy, how about you? Tell us about yourself and why you chose to pursue a career in environmental occupational health.
Sure. So I went the industrial hygiene track at ODU, and I chose industrial hygiene because it's such a versatile sector, and things are just constantly changing, and you're constantly learning and trying to keep up with the latest regulation and latest research. And industrial hygiene is all about evaluating hazards, and I enjoy the investigation part of things, and kind of being like Nancy Drew, trying to find out what's causing this health effect, what's making people sick. So I really enjoy the research side of it. I actually got into it thinking it was more about environmental conservation, which it wasn't, and I was still really pleasantly surprised, and I really enjoyed the degree and the field. And it's I always wanted a job where I could care for people and help people, but I wasn't interested in doing it traditionally by nursing or things like that. So we still get to help people and make sure people are healthy and safe, but kind of in a non-traditional type of way. So,
Okay, great. And you're currently working for OSHA, right?
yes, yeah, I
Yeah,
work for state OSHA.
very good. Great, super. Okay, guys, Erika, let's go back to you with our second question. Tell us what it's like to be a student in the program and about your internship experience.
Well, I just graduated a few days ago, so very fresh experience as a student. Um, and I think that one of the things that I really, really loved about the program was that it's taught by people who are professionals in the field. So people who are practicing what they're teaching in the moment. So they're kept up to date, and like what Suzy was saying, the ever-changing atmosphere that is safety in IH. So the curriculum is very well rounded, and I like that there were several different focuses, but there were some very, very interesting classes that we got to take. So some like communicable diseases and vector-borne diseases, and then you can also go on, you know, a totally different aspect of it and look at food safety. So just the variety of classes was very exciting. And I had two separate internships, one of which I'm serving in right now. So I'm sure you can hear forklifts in the background and things like that as we're talking. But I had an internship as an environmental health and safety specialist at a Bush manufacturing company that made pumps. And now I'm serving as an environmental health and safety intern at Massimo Zanetti Beverages. It's a coffee manufacturing company. So both manufacturing companies with hundreds of employees down on the floor working with things that could be very dangerous. So just keeping an eye out for those hazards and trying to ensure that they're kept safe, and that we also make sure that the company is kind of kept safe. So a little bit of risk management on their part too.
Great, thank you. Suzy, how about you? What was it like to be a student in our program? And certainly you had internships as well. Maybe you could tell us about that too.
Sure. So being a student in the program, I agree with Erika. It's a very well-rounded program. It covers a lot of different areas. One of my favorite classes that I took was environmental emergencies and disasters. So you learn about Chernobyl and Bhopal and all the things that went wrong that led to those horrible public health events and crises. Also, I enjoyed environmental law a lot, and that was taught by an actual lawyer who works in environmental law and is enforcing the Clean Air Act and Clean Water Act, and I thought that was really interesting. As far as internships go, I actually did 3. So the first one I did, I was a safety intern at Hampton Roads Sanitation District. So HRSD is a wastewater treatment company for pretty much all of Hampton Roads. And basically as a safety intern, I assisted in inspections of the wastewater treatment plants, making sure that they were safe, that they were following safety and health guidelines. And then I would formulate reports for any discrepancies that they had, for any corrections that they needed to make. We would do accident investigations if an employee had an injury. We'd go back and kind of try to determine the root cause and what could be put in place to prevent that from happening in the future. So that was a really good internship for me. The second one I did, I was a marina intern at HRSD as well. So in the marina intern, basically you pump out the sanitary holding tanks of boats. So you're going to different marinas. And it is relevant to environmental health because the problem is that people with a full sanitary holding tank in their boat will dump it out in the waterways. And if they do that, it's going to cause algae blooms, and it'll be really damaging to the local waterways. So it was an important public health service that I provided through HRSD. The third internship I did, I was a safety intern at BAE Systems. So BAE Systems is Norfolk Shipyard. And there I did the daily housekeeping and fire prevention inspections on the ships, which was really great. I got to work on US Navy vessels and ships, and I got to see things that most people will never see in their lives. And shipyards are really dangerous places, and there's really a lot of jobs in shipyards because of that. I mean, I think in the last year, there have been a few fatalities at shipyards. There's always scaffolding, fall protection problems. A lot of the ships in a shipyard are just in poor condition. So there'll be holes in the floor, and there's also a lot of industrial hygiene work in shipyards too. In my internship position, I was a big part of the hearing conservation program. And I would take personal noise dosimeters and have employees wear them and go out in the shipyard and do their job to measure their noise exposure. And I was part of determining if they needed additional hearing protection, if we had an effective hearing conservation program to make sure employees are not losing their hearing. And then in shipyards too, there's a lot of places for air sampling. I mean, there's a lot of welding going on, stainless steel welding for hexavalent chromium. So it's really important for us to be out in that industry as well.
Okay, great. Thank you, Suzy. So I know most of our students who do interns get paid fairly well for their internships. Were you guys paid for your internships?
Good question. Both internships that I participated in were paid.
Okay, great. Thank you, guys. So let's see. The third question I want to ask you is to tell us about the role that you play, which I think you guys have already alluded to this a little bit, but maybe you can tell us a little bit more about the role where you currently work in OC Health and Safety.
Like I said earlier, my role right now is still as an environmental health and safety intern. Unfortunately, due to the current circumstances, there's been a hiring freeze put on, so my full-time position has been put on hold. But as in my position right now, I create training and give training to employees on various safety topics to ensure that they are aware of how to do things safely, how to use PPE correctly, how to read a safety data sheet so that they understand the chemicals that they're working with, how to properly lock out equipment so that they're safe when they're working on things. That's a big part of what I'm doing right now. I've also been working on job hazard analyses where I go down on the shop floor and discuss with the employees what hazards are present in their workplace, what abatement measures we already have in place, and then follow up with them and ask if there's anything else that they see that's hazardous and how we could go about fixing it so that they're not presented with that hazard anymore.
Well, you know, so let me ask the question this way. What is the most interesting thing that you've dealt with? I know the pandemic stuff with COVID-19 right now is certainly something we're all coping with, both on a personal and a professional level. But what's the most interesting thing you've dealt with at work? How about Erika? How about you? You can start, and then we'll go on to Suzy.
I'll pass this one to Suzy first.
Okay, all right, Suzy. What's the most interesting? I'm sure working at OSHA, you've come across some rather unexpected, unique things. But what would you say the most interesting thing that you dealt with at work is?
One of the most interesting and scariest days in my job, I was doing a routine comprehensive inspection at a hotel. And normally for any inspection, we have a 4-gas meter with us. So the 4-gas meter is going to measure oxygen levels, hydrogen sulfide, the lower explosive limit, and most importantly, carbon monoxide. And most of the time, everything's fine. You would expect 0 levels of carbon monoxide, especially in a hotel. So we were doing an inspection of the hotel, walking around, and we started to notice on the meter that there were low levels of carbon monoxide. And it was a little bizarre, but it wasn't anything to be concerned of. It was the few parts per million. So we went ahead and we continued the inspection. We went down to the basement of the hotel, and as soon as the elevator hit the lower level, our carbon monoxide meter started alarming. And it was about 200 parts per million. And the permissible exposure limit for carbon monoxide is 50 parts per million, which is over an 8-hour period, but 200 is a lot. And once we saw that, we told the employer, we're going to cut this inspection short, and we called the fire department who had to come out. And it turns out their boiler and their hot water heater had a ventilation issue, and it was leaking carbon monoxide. It was a very scary day, and we were definitely all exposed, but thankfully we were down there for such a short period of time, we didn't experience any health effects. So in my current position, I'm an industrial hygiene compliance officer at Virginia OSHA. So we do those workplace inspections in response to complaints that we receive, or just from a generalist that we receive from the federal government. We also do inspections in response to fatalities, to workplace accidents, amputations, things like that. And during this current health crisis, the pandemic related to COVID-19, OSHA definitely has a role to protect employees in the workplace and make sure employers are implementing things to protect employees from contracting the virus. Right now, we're not doing very many on-site inspections. It's just a lot of compliance assistance, reaching out to employers, especially when we receive complaints, to provide them OSHA's guidelines and the CDC's guidelines, and making sure that they're following the governor's executive orders and any federal and state laws and regulations. But it's really challenging from a compliance standpoint with coronavirus. OSHA doesn't really enforce communicable disease like this, but we have standards for sanitation and respiratory protection, and it's definitely a hazard that is present in the workplace, so it's important to protect those employees. So for question number 4, advice that I have for incoming students, I would say make sure you're taking a broad variety of courses. So make sure you're taking safety, industrial hygiene, food safety, as many as you can. And the reason for that is because a lot of jobs in this field, you're the safety person and you're the industrial hygiene person. You wear a lot of different hats. Sometimes you're responsible for workman's comp claims, like a human resources person would be. So it's important to have that broad range of knowledge and a good base knowledge. And even if you're not using it, to at least understand why things are the way they are. Another recommendation I have is just to do as many internships as you can. It's important to get that hands-on experience, to network and meet people, and I think it really helps once you're in the job market. So the 3 internships I did, they were all really inspection-based, so looking for safety and health hazards in the workplace, and it really led me to my current position. It was like my internships perfectly prepared me for what I'm doing now. So that's my recommendation.
Okay, well, thank you so much. Erika, how about yourself? What are some interesting things you've encountered at work, and what recommendations might you give to incoming freshmen to the program?
So my interesting story is nowhere near as interesting as Suzy's, I don't think. No near-death experiences or anything like that. But what I've found really interesting in this role is the trying to get people really engaged in safety, especially right now with the COVID-19 that's going on, and we've got people working at home. We've got people who have recently been, laid off. There's been a lot of division and stress and anxiety and things like that. So the fact that June is National Safety Month has really kind of lit a fire under me in this So I've found it very interesting, the little games and things that you can get people playing to get them really engaged in safety, and also kind of bring everyone back together. So we've created a sing a song for safety sort of thing. So everyone at Massimo's and Eddie will be making a little skit or a spoken word or jingle or something along those lines, and we're going to post it on our MZB YouTube page, and just make it sort of a competition to get people really talking about safety and also having fun at the same time. So I've found that very, very interesting, and taking all of those things that we've learned and trying to really actually build like a safety culture and in a place. So what I would say for people is Suzy's advice was great. Really just make sure that you have a very well-rounded experience in school. So not just in your classes, but in everything that you do. So I would recommend taking at least one ethics class and a social science class, you know, really understand people and because that's what you're doing it for, is really people and relationships. My supervisor always says. So it's for the company, for risk management, but it's also for those people, making them really understand that, hey, like we need to do all of these things for safety because of the reason we come to work, which is our family, and like getting back home to them with all of our pieces and parts, being healthy and happy. And then also just the involvement, like getting engaged. If I had known the benefits of being fully engaged in all of the organizations at school and outside of school when I first got into school, I think I would have been even better set up than I am now. So when I started at ODU, I was a transfer student. So I'd been in an organization at Tidewater Community College, but then when I came over to ODU, it took me a couple of semesters to really get engaged, but I was in a couple of organizations, but not really participating. And then I found the Student National Environmental Health Association, which is the organization that our Bachelors of Science and Environmental Health really kind of runs and partakes in. So we bring in guest speakers from the area that are actually practicing in the field. So we have industrial hygienists come and speak, and we'll have safety specialists and you know, different people in the public health field even, and really kind of tell us exactly what to expect in the field and get us all engaged. And it's also an opportunity for networking, and not just with the professionals that we're bringing in, but we're creating our own little network that will bloom and grow. You know, so we've now got all of these connections to students that will eventually become our little network that we reach out to when we're full professionals and full adults. So as we're working as safety professionals, we'll have those contacts to reach out to and say, like, you know, I know you kind of work more in, you know, the chemical side of it, so can you help me with this problem? Or I know you just started this policy or this program, so, and we're looking at doing the same thing, you know, help me out, kind of thing. And just the friendships. I mean, so many great memories made in our meetings and our outings and stuff. And getting involved, not just with those organizations in the school, but taking advantage of some of the ones outside of school as well. So as you go through the program, you'll hear people talking about the American Society of Safety Professionals, or the National Environmental Health Association, or the American Industrial Hygiene Association. Things like that I think are hugely beneficial, and it's how I got my internship that I'm in now, getting involved in those organizations.
Characteristics about our profession is much like our clinical colleagues, our profession is people-oriented. We're not just in a lab, stuck in a lab with test tubes. We're out there with people solving problems that really matter to people. We do get to do a little bit of lab work. We get to take some samples and do some lab work, but generally speaking, we're actually out there with people, and that's an interesting, fun, exciting, and at times, sometimes challenging aspect of our profession. So that's great that you guys both highlighted that with your current positions and your experiences. So thank you very much. I think it's great to have you guys on. It's you guys are exemplary students for us to highlight, and I certainly appreciate you guys taking time out to share your experiences and give some comments and suggestions to potential students. And you know, one thing I'll find is I was an undergraduate 30 years ago, and I still talk to people that I went to school with back when I was an undergrad. So I think your comments are certainly well placed in the fact that you guys will probably be talking to each other throughout your entire careers. So it's great to have you guys on, and thank you so much for participating and sharing your experiences.
Can I add something real quick?
Sure, of course.
I don't know if you guys will be able to find a way to weave it in or not, but so I was on a conference call with the American Industrial Hygiene Association once, and someone said something that really clicked with me, that in the safety and industrial hygiene field, what we do is really basements to boardrooms. So we deal with every aspect of the organization. So we're down on the shop floor with the manufacturing people, and we're up in the offices in the ivory towers, or with the CEO. You have to know how to handle all the different people and all the different situations that you're in, really have an understanding how to engage people, and also just the differences in every day. You never know what you're going to expect. So if you're looking for something that's dynamic and really exciting, this is the field for you, because every day when you come to work, it's going to be something different. And you might be, down on the shop floor 90% of that day, or sitting in an office, or you might be up, having meeting after meeting, dealing with, trying to convince someone that, yes, we really do need this $50,000 lift to move these reels around the facility to keep our people safe. And here's the science behind why we need it. So I enjoy the field because of the aspects that we've listed. Like you get to engage with the people, you get to really see something different every day, and it really ties in like the science, the math, and the altruism. Like we get to do good every day and really keep people safe and healthy, and send them home to their families.
Sure, absolutely. And of course, the latest statistics are what, 5,600 people, 5,600 people every year die in occupational fatalities. And the sad aspect of that is those folks are not able to go home to their families. So we get to work every day to try to prevent that from happening. And you guys certainly make a significant contribution, and will make a contribution over your entire career. And that is rewarding in and of itself for those of us that have the privilege of working in this profession. I mean, I can tell you guys a little bit about my experience. I've been in this field for 30 years. And one of the things that's I've always found interesting is that I worked for Exxon as a traditional industrial hygienist. I worked for DuPont in their toxicology department. I spent 2 years working in a drinking water quality program for a state health department. And I've spent probably about 5 years in a state health department working in an industrial hygiene occupational health surveillance program. And I've also worked on, for a state health department, on cancer cluster studies. The Toms River Pediatric Cancer Study was actually the first study I worked on when I had finished graduate school. So I totally agree with you guys. You just never having that flexibility to be able to adjust to different jobs. It really results in great promotion potential, because what you'll find is sometimes the job opens up and they're looking for, hey, we need somebody to be a supervisor of this drinking water quality program, or we need someone to be a supervisor in the safety program or the industrial hygiene program. And having that flexibility and having that broad background that you guys alluded to is very smart on your part, because what it gives you that flexibility so that when you're looking to get promoted, you have the skill set to be able to go for those jobs that are within the umbrella of our profession, but to go to those different jobs and get those promotions. And that's why many of our students over the course of their careers do very well and tend to find themselves getting promoted fairly quickly. And but I think you'll look back as you go through your career and you'll find you'll have done a bunch of different things. And as you said, I mean, many jobs, especially in the private sector, are looking for students who are going to grow to be able to wear many hats, as I think both of you had alluded to. You know, they oftentimes, in corporate America, oftentimes they want somebody who does the safety, does the industrial hygiene, does the environmental permits, you know, and certainly have to have the ability to work with all of those folks. And of course, the COVID-19 pandemic right now clearly shows our incredible need for us to be able to work with people that are the traditional public health, infectious disease type of professionals as well as interact with our clinical people. So I think you guys highlighted that very well, and thank you for pointing that out. It's very insightful, and I think will be very helpful to any students that are considering this profession and who may watch this video. So thank you guys very much.